Hello everyone, my name is Samarpita. I'm a counselor. I represent Spirituality Health Inner Values Academy at its Cuttack branch. This particular video is intended to throw a different light on one of the so-called mental illnesses, depression. I happened to read a book named The Spiritual Guide to Mental Health by psychiatrist Samuel B. Lee. In this book, he has made an effort to convert all the wrong belief systems that we carry about mental illnesses into opportunities for a spiritual evolution. According to Dr. Lee, depression is also known as the dark night of the soul. Depression, from a Western perspective, is a disease that is indicated by the presence of 5 out of a specified 9 symptoms. When one goes to a psychiatrist and fits into these checklist of symptoms, he or she will be labeled as having a major depressive disorder and will be started on psychiatric medications that will alter the serotonin levels in the body, which temporarily numbs the depressive symptoms while never actually dealing with the root cause of the symptoms. Once the body naturally adjusts to the chemical imbalance that the medication is causing, the depressive symptoms can once again return because the cause has never been addressed. Sometimes psychiatric medications may effectively numb the symptoms while one is in a state of crisis, allowing the person to effectively avoid suicide and continue to function in a sick society. The problem is that the root cause of the symptoms is never addressed. The patient just detaches from his or her situation. Usually, the actual problem isn't that the patient is sick, but that he or she is trying to adjust and function in a sick society. So instead of trying to fit into a sick society, perhaps these patients would benefit from trying to find a community that accepts them as they are without trying to change them. From an energetic standpoint, depressive symptoms occur when one continuously experiences low frequency emotions such as guilt, shame, or fear. These symptoms can be traced back to thoughts such as, "What's wrong with me? Am I good enough? I should not have," etc. These thoughts can be traced back to conditioned belief patterns which have been subconsciously ingrained in one's psyche since childhood. These belief patterns can be traced back to how one received love as a child. If a person received love from his father by being perfect in all he does, then he will continue to believe that he has to be perfect in his adult life. For instance, if a child received love from her father by going to a temple, she will learn that one way to receive love from a father is to continue to go to temple. Depression occurs when one continues to exhaust one's mind by having continuous repetitive thought cycles that do not lead to liberation but to confusion, and low vibration emotions permeate into the body, mind, and spirit, and therefore causing insomnia, variable appetite, isolation, anhedonia, which is lack of interest in getting involved in recreational activities or getting involved in social groups. According to the author Dr. Lee, from a spiritual standpoint, depression is a transition state in consciousness. It is a protective mechanism of the body, signaling you to slow down, rest, adjust your lifestyle to one that is conducive to your happiness. Rushed psychiatrists often mislabel grief as major depression and these patients are often started on antidepressants, which actually interfere with the grieving process and numb down the emotions that need to be expressed in order to fully process the grief. This leads to unresolved grief, and the grief can then resurface because it has not been processed and integrated. And if one chooses, he can allow this light of awareness to enter through the wound and change the old programs that no longer serve him and emerge as a higher frequency being. You will even be able to find the light within depression and be able to see how it is an opportunity for growth and a step in the evolution of your consciousness. After overcoming all of this, you will have the keys to the consciousness to help others who find themselves in a similar experience as the one you overcame. During your transformation, you might feel like everything is falling apart, but in reality, everything is coming together for your highest good. You are being pushed to evolve and get out of your comfort zone so that you can live and experience your true greatness. Embrace and welcome change. Depression breaks you out of your comfort zone of subconscious programming and forces you to take an honest look at all the areas of your life and make changes that are in accordance with your true purpose and happiness. According to Dr. Lee, depression from a Western perspective is often viewed as a disease or a symptom of weakness or failure. This viewpoint was adopted by the general Western collective consciousness by creating a book called The Diagnostic and Statistical Manual of Mental Disorders and loads of effective advertising. This advertising has misled the general public to believe that depression is secondary to a chemical imbalance in the brain, which Dr. Lee thinks is a flat out lie, since there is no way to measure the chemicals in the brain effectively, and no psychiatrist ever does this prior to diagnosing or prescribing potentially addictive and harmful medications, which actually create a chemical imbalance rather than fixing one. The DSM-5 has labeled anyone who experiences 5 out of 9 symptoms of depression for 2 weeks or longer as having major depressive disorder and recommends placing the patient on medication, most commonly the SSRIs, selective serotonin reuptake inhibitors. When someone who is depressed goes to see a psychiatrist and is labeled with a depression by his authority figure, they often start to believe that they have a disease and there's something wrong with them. This thought alone starts to resonate through the body, and the body starts to code for proteins, hormones, and chemical messages that are in alignment with the idea, and that there is something wrong with them. As soon as someone believes that they have a chemical imbalance, it actually causes one. Then the person who is depressed starts feeling like I'm abnormal. This leads to isolation. This leads to further depression. And that they are started on standard Western medications. These medications can be fairly successful at numbing down the symptoms one is experiencing. However, over the period of time, these medications actually end up causing a chemical imbalance, making it nearly impossible to actually address the cause of the depression, which often originates at an energetic or a spiritual level and is presenting itself as a symptom. All Western antidepressants will typically shut down or numb energy centers in the body, make them ineffective. Most antidepressants can effectively numb the frontal lobe and sufficiently chemically lobotomize the patient so that they can continue to function in their dysfunction. Most Western antidepressants will cause a sexual dysfunction and shut down the second chakra or center of creative energy, which occurs more than 70% of the time. When the frontal lobe is numbed, it makes it nearly impossible to exercise the judgment needed to actually start addressing the root cause of the depression, because a sense of judgment and intuition is numbed. After several months, when the body becomes used to being numb and becomes addicted to the feeling of numbness or chemical imbalance, that is now being perceived as normal. This whole time, the actual cause of the depression is not being dealt with. For example, if the cause of depression was being in an abusive relationship or continuing to go to a job that is not in a line with one's purpose, the person will continue to cause daily harm to himself by continuing in the cause of the symptoms while numbing oneself down enough to continue to function in that dysfunctional situation, because the body and the mind are numbed. They will not be able to hear or respond to the subtle promptings of the heart and intuition. Therefore, although the person will be able to function normally in society, the actual cause of the problem is not being dealt with and will continue to cause stress and disease on a subtle level. Dr. Lee gives an example of a negative of a photograph. The negative symbolizes the actual cause or the source of the depression. The photograph symbolizes the symptoms of depression. Western medications try to numb or destroy the photograph, which are the symptoms, while never actually dealing with the cause, the negative. Or even if you destroy the photograph or symptoms can always reappear, because the negative or the actual cause has not been addressed. Actually, the antidepressant medications will cause a chemical imbalance, create a physical and mental addiction, and stop working. At this point, the Western psychiatric practice is to increase the dose or add another antidepressant, or even sometimes add low dose antipsychotics or other medications that still do not address the root cause but only cause more side effects. This cycle continues until most patients are addicted to many different psychiatric medications, numb to their own feelings, energetic guidance, and end up hopeless and even being suicidal. Dr. Lee, in his book, has shared his experience when he started seeing a therapist and taking Lexapro and SSRI. It numbed him long enough to finish his medical residency. Western treatment at this time was a blessing for him, as it can be in times of extreme life or death situations. It helped him survive and complete residency. It was easy to be numb, as actual intuition was not really needed during his psychiatry residency. If you decide to safely get rid of psychiatric medications, Dr. Lee recommends to find a physician who is attuned to natural treatments. If you go cold turkey or stop your psychiatric medications too quickly, you may experience withdrawal symptoms such as dizziness, loss of coordination, fatigue, tingling, burning, blurred vision, insomnia, and vivid dreams, often referred to as brain zaps. Occasionally, you may also experience nausea, diarrhea, flu-like symptoms, irritability, anxiety, and crying spells. When helping a patient wean of the SSRIs, 5-HTP or St. John's wort can be safely utilized. He recommends to safely get rid of medications to avoid the possibility of serotonin syndrome, which can produce sudden onset symptoms of fever, shivering, sweating, diarrhea, confusion, and muscle spasms. The author has never witnessed anybody experience serotonin syndrome while utilizing 5-HTP or St. John's wort while reducing the SSRI dosage. Depression is the universe uh, trying to work for you, not against you. Depression is not a disease you should feel bad about. It is not a chemical imbalance in your brain. There is nothing fundamentally wrong with you for experiencing and depressive symptoms. You do not need pity from people when experiencing depression. It is an opportunity to detach from what does not make you happy and attach to what does. It is an opportunity to evolve in consciousness so that you can eventually help people. It is the ultimate paradox in life where one experiences sadness in order to truly appreciate happiness. He says depression is a blessing in disguise. It is an opportunity to take a look at your belief systems and reframe them to what is in alignment with your purpose and path. Most Western psychiatrists are abiding in a system that has trained them to ask about a checklist of symptoms, then prescribe medications. There is no time to closely look at or address the root cause of the symptoms by the doctors. If you go see a traditional Western psychiatrist for depressive symptoms, no matter what the cause is, the most likely cycle will be being placed on medications. The medications stop working, the psychiatrist increasing the dose of medications, or trying to add a different medication. When the symptoms become severe and suicidal thoughts emerge, this could mean a trip to the local inpatient psychiatric hospital where you will be locked up and likely forced to take medications until your spirit is broken down enough to simply give up and comply to the system. If you resist taking psychiatric medicines while in the inpatient psychiatric hospital, your stay most likely will be prolonged. When you have tried multiple antidepressants, failed at least three different medications, and still are severely depressed, this can lead to a referral for ECT, electroconvulsive therapy, where you will be hooked up to electrodes which cause seizures in your brain. The theory is that it shakes up the brain enough so that it is rewired so that you either forget you are depressed or no longer feel depressed. Another treatment on the rise for severe refractory depression is a transcranial magnetic stimulation. The provider will use a magnet to stimulate certain parts of the brain, and after a certain number of treatments, the patient seems to improve. This treatment option may be less barbaric than ECT, as claimed by the author. The root cause of the depression is not being dealt with, and the symptoms are likely to return in both the cases. So, let us stop saying depression. Let us say time for evolution to make this world free from pollution. Thank you.